Ajay Chepot. Hi cousins, it's me, Dr. Evan Adams. I've been a doctor for almost 20 years, and now I'm the Deputy Chief Medical Officer at First Nations and Inuit Health Branch headquarters at Indigenous Services Canada in Ottawa. COVID cases worldwide are at 117 million cases, with 2.6 million deaths thus far. The official number of COVID cases in our communities in Indian country in Canada is well over 22,000 of us, with more than 1,300 cases active right now. 350 First Nations communities have had clusters or outbreaks of COVID-19. More than 1,000 of us have been sick enough to be hospitalized. And the number of deaths on reserve across the country due to COVID is approaching 250 First Nations people, and that doesn't count our Indigenous cousins in the city. But now we have a vaccine, 3 in fact, and we are facing the possibility of a brighter future. In line with the National Advisory Committee on Immunization Guidelines, we would like all Indigenous adults to be immunized as quickly as possible against COVID-19. Already more than 3 million doses have been delivered across Canada, including more than 130,000 doses to 480 Indigenous communities. And TlaAmin Nation is one of those nations that has begun to immunize its members against COVID-19. Thank you, Tla'amin Health staff, the First Nations Health Authority, and Vancouver Coastal Health, Marlene Christensen, Melinda Hasselback, Losa Luefoa, Melly de Champlain, Brent Tom, Judy Mitchell, and so many others for your incredible work on our behalf. Many of us will be offered the vaccine soon, and for those of you who are still on the fence, it's time to make a decision. It's your body, your choice, but let's give you the facts that you need to be informed and to decide to get vaccinated. First Nations people haven't always had the best relationship with medical research. For instance, some medical experimentation did happen in residential schools, it's true. And that was truly terrible. But now we have checks and balances, oversight, and many of us watching over this process, so it is safe. COVID-19 vaccines meet extremely high standards of testing, safety, and quality. All COVID-19 vaccines are tested on tens of thousands of volunteers before they are approved, and already 290 million people have been vaccinated worldwide, and we are continuing the most intensive safety monitoring of a vaccine in world history. Does the COVID-19 vaccine have side effects? Yes. But mild side effects from vaccinations are normal and are to be expected. The main side effects, and you've probably experienced them from other vaccines that you've had, are mild, are more common after the second dose, and include pain at the injection site, tiredness, headache, joint pain, and mild fever. Anaphylaxis after COVID-19 vaccination is rare. The risk of not being vaccinated is far greater than the risk of side effects. Who shouldn't get the vaccine? People who have a known history of a severe allergic reaction to any component of the vaccine, and those with a history of vaccine allergies. If you have a history of severe allergies, you can speak to your doctor to see what the chances are of you having a reaction or not. It's just a very small percentage of us that need to have that discussion with our doctor. People with other severe allergies, like food or mold, should be fine to get the COVID-19 vaccine. People with underlying medical conditions and the elderly can also get the COVID-19 vaccine. The vaccine may be appropriate for people who have a suppressed immune system due to a condition or disease, or because they're undergoing a treatment for a disease like cancer. This should be an individual's decision after consulting with their healthcare provider. So get ready, be informed, stay vigilant, protect our elders, help your family find safety. Let's get vaccinated and protect TlaAmin Nation. Imut. Thank you.